Your Harrogate's Wellness Wednesday with O'Connor Chiropractic, optimising the health potential of every family through chiropractic care.
Welcome to another Wellness Wednesday on Your Harrogate Radio. Now, Dr. Jason is here. We talked last time about the vagus nerve and how that can help with a multitude of functions within the body. You mentioned sleep, and you gave us a case study where the lady improved her sleep massively. So the spine-sleep connection, let's just talk a little bit more how chiropractic care can actually improve somebody's rest.
Yeah, we all want good sleep, and everything is easier when we've had a good night's sleep. And there's different qualities of sleep, as we know. We can go into, and it's to do with the brain frequency and where it goes into, it's like hertz, whether it goes into that deep, lower level hertz, which is the body really recovers and heals and repairs, and that's when we feel properly refreshed, as opposed to that light sleep when we're just in and out and broken. And again, a lot of it's to do with that state of the nervous system. We said whether we're in a state of fight or flight or parasympathetic, we're in a more restful, restoring state. There's lots of different things that can impact your sleep. So obviously posture in terms of position in bed. So we always like to give advice on getting patients to sleep on a side, using one pillow, type of mattresses. There's that side of it. And there's also not overstimulating the nervous system. So we know blue light, not on our phones, but what do we all do? I'll just have a quick check on social media. I'll just check an email. And that's like activating the brain. So really for sleep, you want to be you're trying to reduce the stimulation to the nervous system as much as we can. So that's why we go in a dark, quiet place, no stimulus, no noises, bright lights, those type of things. And we want to calm the nervous system down. That can be very difficult, however, if someone's spine is subluxated, it's out of alignment, because what you've got, and especially if it's a chronic issue, you've got the spine which is out of alignment, which is irritating those nerves. And the brain is getting sensory, or what we call nociceptive pain signals up to the brain. So it's going to stay on a state of alert. It's not going to want to go into a deep sleep if it's getting stimulation of damage. So often when people have got chronic back joint issues where they're getting nerve pain, they're not going to get into a good quality sleep. So that's why having chiropractic care, if we address those underlying issues. So even it doesn't work if you're taking painkillers, because the signals are still coming in. Whereas actually we adjust the spine, remove that interference, we get the nervous system to calm down, we're getting less input into the brain, and people then are able to get into that good quality deep sleep.
Once you've started with a patient, you've done those initial tests and you've got them in and you've made the first adjustment, would you say it's the number one first positive effect that people say to you, "Oh, Jason, I've had a great night's sleep"?
I'd say sleep is the most common side effect of chiropractic care is, like you say, a relaxed nervous system, which means better sleep. Another common one is better digestion. And another one is like better immune function. And they're all linked in. And it's about that going from that fight or flight, sympathetic dominant to parasympathetic. And just people go, "Gosh, changed my life," because they were using so much energy and then it's this event state, and then when you shift them to relaxed state, they can't put their finger on it. They just know that their body's functioning better. But when we get the feedback, that's the thing, that the parameter that they can measure is, "Oh yeah, I'm sleeping better."
We talked again last week about the vagus nerve and how much torque there is, and we all know how algorithms work. So let's say somebody's at a situation where they're desperately trying to find answers of how to sleep better, and cutting out that noise before bedtime. What's your advice? Would you say an hour before, really, to shut things down?
I think you have a good hour where you're allowing the brain to wind down. You know, people are different, but I think if you are struggling, give yourself that good hour. I always say exercise. So I always, like, if I had a good workout, I'm out like a light. You know, I'm going straight to sleep. There's no problems whatsoever. But when you've had those days where especially people, office workers, where they're sat around all day, not really getting the heart rate up, not really burning much energy, they've had a lot of stimulation, I think they find it a lot more difficult to get into a good quality sleep. So I find going for a brisk walk just around the block, that can often help as well.
So if anything that Dr. Jason has said there hits home and you would like to explore chiropractic care for yourself and your family as well, then you can simply get in touch with O'Connor Chiropractic, the Family Wellness Centre on Station Parade in Harrogate, via their website.
Your Harrogate's Wellness Wednesday with O'Connor Chiropractic. Book your initial consultation now at o'connorchiro.co.uk.